Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
You may not know this, but every heartbeat is powered by electricity. But what happens when things begin to misfire? Today, we have Dr. Bryan Wilner. He's an electrophysiologist with Baptist Health Heart and Vascular Care, and he's here to share his expert advice on what to do when the heart begins to beat irregularly, as well as answer your questions on this episode of Ask the Doc, No Appointment Needed. Hi, I'm Miranda Kahn, and welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. All right, let's kick things off with a question from Tristan, who reached out to us through our website, allhealthtv.com. Tristan's question is, hey, Dr. Wilner, I've been having weird heart palpitations lately, so my primary care physician wants me to go see a specialized cardiologist called an electrophysiologist. Please explain the difference between an electrophysiologist and, say, an interventional cardiologist. Dr. Wilner, what a perfect question to kick the show off with. But before you share your thoughts, Doctor, let's check out this video from the folks at the Mayo Clinic.
Some symptoms that you might expect for heart arrhythmia are often red flags for seeking treatment or screening.
If a symptom is serious, so a sudden collapse or loss of consciousness, that's immediate attendance to emergency department. Likewise, if one's having palpitations, so the heart racing away unexpectedly and associated dizziness, lightheadedness, another reason to go to the emergency department straight away.
Chest pain also can be an obvious sign and may require emergency care. Some heart palpitation symptoms may be less frequent and severe, but still should be assessed by a healthcare clinician.
The other thing that's a red flag, in particular in young patients, is if there's a family history of concern. Accepting that that person may not have any history of heart problems themselves already, if they know that there is a family history of somebody at a young age having had a premature sudden death, or if there's a family history of inherited heart problems, then that may flag up that there is a potential risk if somebody's having symptoms or may actually just need screening from the point of view of preventing risk before they develop symptoms.
For the Mayo Clinic News Network, I'm Jason Howland.
All right, back to Tristan's question, Doctor. What is the difference between a cardiologist and what you do?
Yes, thanks so much, Miranda. Tristan, that's a great question you asked. So the difference is an electrophysiologist is a cardiologist that specializes in heart rhythm disorders. We like to think of ourselves as the electricians, whereas we say the interventional cardiologists are known as the plumbers, where they treat diseases such as blockages in the heart and valve problems, whereas the electrophysiologist treats heart rhythm disorders with procedures such as ablations or pacemakers.
That's so fascinating. So heads up, Doc, we've got a question from Jamie. He asked, Doctor, what's the connection between atrial fibrillation and a stroke? I've heard something like 20% of strokes are caused by AFib. Thanks, Jamie. That's another great viewer question. So Dr. Wilner, what are your thoughts?
Jamie, that's a great question. So atrial fibrillation is the most common heart rhythm that electrophysiologists treat. And it's an irregular heart rhythm where it causes the top chamber of the heart to beat irregularly or fibrillate. And when it fibrillates, it's not getting a nice contraction, so blood is not flowing well through the top chamber of the heart. When blood does not flow well in the top chamber of the heart, that can increase the risk of a clot forming. And if a clot formed in the heart and got pumped out of the heart, it could go to the brain and cause a stroke.
All right, good to know. This next question comes from our Facebook page. It's from Elijah, who asks, hi, Doc. I was diagnosed with atrial flutter, so my cardiologist has scheduled a cardioversion for me. I did some research, and I learned that there are two different types of cardioversions. Can you tell me more about this procedure? It sounds a little scary. Doctor, I don't think I've ever heard of a cardioversion before, so I'll tag on Elijah's question. What is it exactly?
Yeah, Elijah, that's a great question. So let's back up. So atrial flutter is a very common heart rhythm where it's due to basically a specific circuit in the heart gets activated and it can cause the top chamber of the heart to beat very fast. And because of that, the bottom chamber can beat fast as well. There are several different treatment options to treat atrial flutter. A cardioversion is one of the treatment options in which we place a pad on top of your chest and we deliver energy to resynchronize the electric system in your heart to get you out of atrial flutter back into normal rhythm. However, a cardioversion is just a band-aid over the problem. It doesn't actually prevent the atrial flutter from coming back. If that's an option where you wanted to prevent the atrial flutter from coming back, you would need to be evaluated for a different procedure called an ablation.
So are there two versions of it, though, going back to that question?
Right. So there aren't two different versions of cardioversions. A cardioversion is a very standard, non-invasive procedure where we're just placing a pad on the top of the chest and delivering electricity. But there aren't two different types of cardioversions.
Up next is another question from our allhealthtv.com page. This time it's from Artie. Artie asks, Doctor, I'm studying to be a physician's assistant specializing in cardiology, and I'd like to know what advances in electrophysiology are you most excited about for the future? Doctor, I'd love to know your thoughts about this as well.
So one of the most exciting aspects of electrophysiology is that the technology is always changing in our field. The most, exciting aspect that I'm excited about is how we're doing ablations. Recently, there's a new energy source that came out on how we do ablations called PFA, pulse field ablation. And then on the pacemaker side, we're now doing pacemakers, leadless pacemakers, which is another tremendous advancement in the field.
Ooh, that's exciting. All right. Well, we've got another YouTube question. This time it's from Elisa, easy for me to say. Dr. Wilner, how have minimally invasive procedures changed outcomes for patients with rhythm disorders? Ooh, I really like this question. So, Dr. Wilner, we'd love to know your thoughts on this.
Another great question. So the majority of the procedures that we do are minimally invasive procedures. And the reason that that's so exciting is because it allows us to offer procedures to more patients, but it also allows patients to recover much faster. The majority of the procedures we do, ablations, pacemakers, are for the most part outpatient procedures. Patients leave the same day. They're back to living their normal life the next day.
Oh, great to know. Dr. Wilner, this next question comes from Facebook. Axel writes, hello. My grandfather, father, and cousin have all suffered from heart issues like arrhythmias and heart attacks. This obviously has me a little concerned, and I want to know how much this increases my risk. Thanks so much for reaching out, Axel. Such an important question, Doc, and one I'm sure many of our viewers watching have. So, Doctor, how significant is your family history?
Yeah, Axel, that's a great question. So family history is very important. There are many, arrhythmias and heart attacks do have some aspect of a genetic component. And if you have a family history, it's very important you let your physician know about that so that they can try to modify your risk factors to prevent you from having an arrhythmia or heart disease.
Dr. Wilner, we've got another question from YouTube. It's from Ellie, who asks, hi, Dr. Wilner, what's the difference between a pacemaker and an implantable cardioverter defibrillator? I know they are very different, but kind of help the heart along, right? I'm confused about this myself, Doctor. I know you kind of talked a little bit about it, but how about some clarification?
Yeah, we get this question a lot. So pacemakers are used when patients have a very slow heart rate. We implant a pacemaker that basically increases the heart rate. Defibrillators are pacemakers with the added function that if you ever went into a very dangerous heart rhythm, such as ventricular tachycardia or ventricular fibrillation, the defibrillator aspect can shock your heart out of that very dangerous rhythm.
Okay, this next question is from Samuel, who reached out to us on allhealthtv.com. And just as a side note, if you haven't already, you really should check out the website when you get a chance because it is just filled with so much great and very useful information. All right, back to Samuel. So here's his important question. Doctor, my father is having catheter ablation surgery, and I'd love to know what this procedure is and how it works to help get atrial fibrillation under control. Doctor, this is such a great question from Samuel. Explain, if you can, the procedure and how it works.
Yeah, so atrial fibrillation, as I explained previously, is an irregular heart rhythm where the top chamber beats irregularly. And that's due to focal misfiring of electricity from very specific areas of the heart. So, what we do during a catheter ablation is we place a catheter, which is similar to a long wire, through the vein in the groin up into the heart. And we go to those very specific areas in the heart where atrial fibrillation originates from. And we do what's called ablation. So, we deliver energy to those areas. And essentially what we're doing is creating little areas of scar tissue that prevents the atrial fibrillation from leaving those areas that leads to the triggers for atrial fibrillation. So by having an atrial fibrillation ablation, that significantly decreases the risk of having recurrence of atrial fibrillation.
I kind of want to go back just for a second to a question that we had earlier and some things that you really were excited about some of the advances in that. You mentioned a new technique. Can you kind of just talk about that technique and why you're just so excited about it?
Absolutely. So traditionally, the way that ablations were done was with either freezing or burning tissue in the heart. And while very effective and very safe, there were some potentially very dangerous complications. When you burn or freeze tissue, it's not specific to just the heart muscles. So there's risk of damaging any collateral damage, collateral tissue in the area, such as the esophagus. So it would really limit how much we could get effective ablation applications in those areas. Several years ago, a new ablation technology became available to us in the United States called pulse field ablation, which is a non-thermal energy source. So it essentially creates an electric field, and the frequency of that electric field is specific for just damaging the cardiac tissue that we want to damage without damaging any collateral tissue. So it allows us to offer a very effective procedure, but now it's safer.
Yeah. Oh, that's exciting news. All right. Our next question comes from Willow. Thank you for explaining that, by the way, on Instagram. So he is asking, hi, Dr. Wilner. I'd like to know what the biggest misconceptions people have about palpitations or irregular heartbeats and how you combat misinformation that's always out there regarding medical procedures. I love this question, especially in this day and age. Doctor, I would imagine, to Willow's point, it has to be a lot tougher nowadays, right? With social media?
Yeah, absolutely. So what's really important is when we see patients that say they have palpitations or they feel irregular heartbeats or fluttering in their chest, is we have to figure out why they're having those symptoms. So one of the most common reasons is if you are actually having a heart arrhythmia where the heart can be beating out of sync. And what's so important if you're having those symptoms is to see a physician so that they can put a monitor on you so that we can see exactly what your heartbeat is doing and what rhythm you're in when you're having one of those symptoms.
I'm curious, just going back to that point of misconceptions out there, have you ever had someone come up to you? I'm sure you have. They read something online or they go on social media and then they're talking to you and saying, no, I read this. And then you're having to combat that, I would imagine, more and more.
Yeah, so social media, the internet, what it has allowed is for patients to be a lot more informed in a lot of the medical diseases that we treat in the procedures. So in my experience, having patients that are more informed and more invested in their care ultimately is best for the patient. But absolutely, whenever you have a question, you should follow up with your healthcare provider regarding that.
Don't just believe everything you read, but it is good that people are getting involved and taking the time to do the research. All right, doctor, this next question comes from Enzo, who posted it on our Facebook page. He writes, hi, Dr. Wilner, would love to know your thoughts on wearable devices like smartwatches that supposedly monitor your heartbeat. Are they really beneficial? That's a great question because so many people are wearing them. I bet a lot of people watching right now are wondering the same thing. What do you say, Doc?
I would say absolutely. They're very beneficial. So there's many wearable devices like smartwatches that, that can detect arrhythmias, specifically atrial fibrillation. And it allows us to, to diagnose patients and also to offer treatment to patients that otherwise may have an undiagnosed, very serious arrhythmia.
So let me ask you, if someone is having heart issues, would you advise them then to maybe purchase a smartwatch of some kind to monitor their heart?
Yeah, so I think the smartwatches are very beneficial as almost like a screening tool where if it says that something is abnormal, that should trigger the consumer or the patient to want to go see a healthcare provider, to further investigate whether that's something that needs to be concerned about or not.
All right, this next question comes from Iris, who reached out to us on our website, allhealthtv.com. And Iris writes, Dr. Wilner, I've had the occasional irregular heartbeat over the past few years. Can stress, sleep apnea, or other non-cardiac conditions trigger arrhythmias? I'm interested to know the same thing because you hear that stress is actually the leading cause of death. Is that still the case? And how much do these things specifically impact or could trigger arrhythmias?
So, irregular heartbeats can be caused by many, many different, causes. One cause definitely can be stress. And I think when patients are stressed, they're just much more in tune to their heart and can feel irregular heartbeats. Another disease that was up there was sleep apnea. So many patients that have sleep apnea also do have arrhythmias. So it's very important if you have arrhythmias that you need to get screened for sleep apnea. There's other, causes of that can cause irregular heartbeats, energy drinks. So, it's just important if you're having an irregular heartbeat that, again, you need to see a healthcare provider to see whether it's something that is dangerous or not.
Okay, Doc, I have to follow up. You mentioned energy drinks. They're so popular right now, whether they're sugar-free kind or regular kind. I mean, they've just grown immensely in popularity. How dangerous would you say some of these drinks are, especially the people that may or may not know that they have an arrhythmia or heart condition?
Yeah, that's a great question. And like you said, I feel like the energy drink market has exploded recently. And, a lot of different energy drinks have different ingredients in them. So I'm not going to make a general statement about them other than to say that it's very important if you do have heart disease or a weak heart or a known heart arrhythmia that you talk to your doctor because a lot of these energy drinks are not good for patients with those conditions.
All right, our next question. Thank you so much. Our next question comes from YouTube. This one comes from Harper. Harper is asking, hi, Dr. Wilner. I'm a hardcore weekend warrior who's all about to get tested for arrhythmia. How do you personalize treatment plans for athletes or other highly active individuals with arrhythmias? First off, I got to say good for you, Harper, for staying active. I'm sure a lot of athletes can relate. Doctor, how do you personalized plans like for athletes?
Yeah, so many times we see athletes who, need to be screened if they have arrhythmias. And, as a first step, most healthcare providers would get an EKG just to make sure that your heart rhythm at baseline looks normal. And then, based on that, what's most important is whether or not you have symptoms when you're exercising or whether you have a family history of heart arrhythmias or, such as what's called sudden cardiac death and aspects like that. So it's just important that you see a healthcare provider before you're going to significantly, exercise.
Well, doctor, I have to thank you so much for coming on because, as someone who has lost family members to heart disease, it's very comforting to hear some of the things that you're saying. I feel like I'm learning a lot as well as some of the people out there because it's still heart disease is the number one killer for men and women, not just in the United States, but around the world. So I have to ask you, what inspired you to go into this particular field?
Yeah, so electrophysiology is such a unique field in several ways. I think what's most unique about it is the procedural aspect and the technology is just always changing. Like I had said before, the way that we're ablating today is very different from even 3 years ago. And it probably will be different in the next few years. So it's just a field that's constantly changing. And it's also a field that really, we really do have really good treatments for the majority of arrhythmias that patients have.
So kind of bearing in mind many of the things that we've talked about, one of the questions we did talk about was misconceptions. You address some of that, and you want people to be informed, to do their research, to take part in their care. But what are some misconceptions that you hear day in and day out that you would just love to clear up right now?
I think, one misconception is that when patients say they have atrial fibrillation, I hear patients say, well, I heard ablations don't work. And, the reality is ablations have made tremendous headway. And again, where they were 10 years ago and how we're treating a lot of our patients. And, it's just important, if you do have a heart rhythm, most patients deserve being evaluated by an electrophysiologist at least once to see if we have treatment options that can help them.
What kind of changes? I mean, I know you talked about some of the advances that you're really excited about in the future, and that it's constantly evolving, which I can tell you're very passionate about and excited about. But what are some, changes that have happened recently that get you excited the most?
So again, I touched briefly on the pulse field ablation, the new way that we're ablating. The ablation times have become so much faster. What used to be a 6-hour procedure, a lot of times can be done in an hour. Patients leave the same day. Really, they're back to living their normal life the next day. So I think, again, what's most exciting is that patients can have these procedures and they're back to normal the next day.
What would you say to people who are thinking about joining your field? What would you say to someone aspiring to be the next Dr. Wilner?
Best field in medicine.
You summed it up. You still love it as much as you did when you started?
Yes.
You can tell you have a good heart, Doc, a good heart. So to kind of sum up some of the key points that we made today, if you were going to just kind of sum it up, there were 3 main things that you want people to take home today from watching the show. What would they be?
If you feel that you have palpitations or an irregular heart rhythm, it's important that that gets further evaluated with what's called an ambulatory monitor, where we can see exactly what your heart rhythm is. I would say risk factor modification is very important for overall heart care, but also for heart rhythm disorders. The importance of exercise, good sleep hygiene, limiting, alcohol use. All these are very important in preventing arrhythmias. And, most important is, exercise, again, reduces stress. It can decrease a lot of arrhythmias, and it's just really important for overall well-being.
Yeah, there are so many risk factors out there for not just heart disease, but lots of diseases. What would you say is the biggest risk factor when it comes to your particular profession and, your heart?
Yeah. The most important risk factor is the one we can't modify: age. So, as we all get older, it's important to, stay on top of your health.
Now, you say age, I can't leave it there. So what age are we talking about?
I don't know. Older.
Older. Okay. So we shouldn't feel so bad. But, we have seen, and a lot of people that are getting diagnosed younger and younger when it comes to not just heart disease, but lots of diseases. Why do you think that is?
Yeah, that's a great question. So I think a lot of patients are getting diagnosed younger because everyone's just more aware of, healthcare. Again, going back to social media and even in electrophysiology and arrhythmias, people wearing smartwatches. So we just have a lot better ways and more accessible ways to diagnose patients with these diseases.
I'm so glad you said it that way because, my initial thought was thinking that we're getting unhealthier, but you're saying, no, maybe we're just catching it earlier.
Yes, that's what I think. Yeah.
Yeah. Okay. Well, so that's a lot more optimistic and I think we want to hear right now. Doctor, thank you so much for joining us here. I really appreciate having you. Last word to you, anything you'd like to say to our viewers?
No, thank you so much for having me. This is great.
Yeah, you're great. You have a good heart, Doc. We really do appreciate it. Please come back again.
Thank you.
All right, that's all the time we have for today. I'm Miranda Kahn, and we'll see you next time on Ask the Doc. No appointment needed.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.